Congratulations. Well, actually, it doesn't matter. What matters is that your baby is beautiful, healthy, happy, 10 fingers, 10 toes, perfect. Well, almost perfect. There's that one thing. Your provider has mentioned the tongue tie. Ankylosing or tongue tie is a condition where the lingual frenulum, the piece of tissue that underneath the tongue that attaches it to the bottom of the mouth, is either too short or too tight and keeps the tongue from moving properly. According to an article published by the BBC in July 2019, frenulectomies, those are surgeries to correct or release tongue ties, increased more than tenfold in the United States between 1997 and 2012. Now, though I'm just starting my career, I've witnessed several diagnoses of tongue tie and the resulting frenulectomy. 80% of the out of hospital births that I've assisted have been babies born with tongue tie. Recently, there's been a significant increase in the number of infants undergoing minor surgeries for tongue tie to aid in breastfeeding or to avoid potential health problems. However, studies indicate that a large portion of these procedures may not be necessary. Maybe we're getting them because parents just want them. Maybe we're making up solutions to problems, or maybe because they're just so darn lucrative. Many experts believe that the rise in diagnosing tongue ties is due to consumer demand rather than concrete scientific proof. According to Katie Thomas for the New York Times, December 2024, the surge in interest for tongue tie on Google has been steadily rising, with searches more than doubling since 5 years ago. Tongue tie release was originally designed for infants experiencing feeding difficulties, but it has become increasingly popular over the last 20 years. Dr. Christopher Hartnick, leader in research in Massachusetts Eye and Ear Hospital, stated that there has been a notable increase in surgeries for tongue tie and upper lip tether release, even though there's limited evidence supporting their impact on breastfeeding success. Outside of feeding difficulties, a number of families opt for tongue tie release to improve a number of problems. Parents often seek the vision of their child's tongue tie because they believe it can hinder the child's speech development. According to S. Becker's report, and ankylosing or tongue tie, there's no good controlled trials investigating tongue tie and the onset of speech difficulties. Dentists frequently detect tongue tie during regular dental exams, whereas in some countries, breastfeeding specialists typically refer children to dentists for tongue tie therapy, per the Infant's Journal article Tongue Tie Exploring the Myths. Many organizations advocate for the separation of tongue tie when it affects oral hygiene, but there are no controlled studies on this issue. While parents might opt out of the surgery as a panacea, practitioners might find different benefits from tongue tie release. Lactation consultants and dentists have been strongly advocating for these procedures, even for babies who don't show obvious signs of true tongue ties. Supporters of tongue tie release recommend utilizing laser therapy to target not only the tissue under the tongue, but also the connecting webbing between the lips and cheeks to the gums. Recognizing and fixing these oral ties have developed into a specialized area, frequently requiring significant financial investment. The December 2023 New York Times reports on a well known dentist in Manhattan who makes millions every year from his tongue tie practice. Lactation consultants who refer patients and assist dentists also get paid. Furthermore, companies that manufacture lasers are taking advantage of this increasing trend. Because of how quick the procedure is, along with ever increasingly loose definitions of tongue tie, the prevalence of frenulectomies is unlikely to slow down. Tongue tie release is a centuries old procedure touted as a solution for problems ranging from feeding difficulty to tooth decay. While there are some babies who do experience effects of tongue ties or tongues being tethered to the mouth, many do not need surgical correction at all. Many infants and children are affected by tongue tie. It's important to give parents accurate information and guidance on the symptoms and potential benefits of tongue tie release, and to make sure that proper arrangements are made for babies who require the procedure.